Hello, dear student. Myself Arif Khan Pathan. Welcome once again in the fourth part of the antibiotics. So, in this first example, we'll see the ampicillin. Ampicillin basically it's an alpha amino benzyl penicillin. Basically, all the things are same as like that of the benzyl penicillin we had seen. Plus additional, it has amino group on the alpha position. That's why alpha amino benzyl penicillin is called as ampicillin. That's why in the chemical name also what we are doing, the acetamido is the same, just we had seen in case of benzyl penicillin. On the acetamido, on second position there will be a 2 amino. This is an additional thing like alpha amino. 2 amino is an additional thing, and 2 phenylacetamide is same as like that of the benzyl penicillin. Penicillinic acid is the parent nucleus, remaining structure is a penicillinic acid. So it has a penicillinic acid on the penicillinic acid at the sixth position, acetamido on acetamido, second position 2 phenyl 2 amino. Okay, so alphabetically 2 amino come first, then comes phenyl. That's why 2 amino 2 phenyl acetamido. It is at sixth position of penicillinic acid. So this was just the chemical name and the structure of the ampicillin. Next, the physical properties. It has a white, odorless, bitter crystalline powder. Hygroscopic in nature. It has a hygroscopic in nature, and that's why one should have to be follow the storage condition, that it should be stored in tightly closed light resistance container in cool place and temperature not exceeding 25 degree Celsius. And as far as the solubility is concerned, it is sparingly soluble in water. Now, these are the uses of the ampicillin. Ampicillin, again, the most popularly used antibiotics nowadays. It is used in the respiratory tract infection. It is used in the urinary tract infection. Then gonorrhea, which is a STD, sexually transmitted disease. Gonorrhea also systemic way. The ampicillin is effective one. Next, in meningitis, in enteric infection, normally typhoid like that. These are the enteric infection. So in these also, ampicillin is most effective. Septicemia, that is the circulation of the pus. It is a generalized infection in which the circulation of the pus in the blood, so that is called a septicemia. And in this infection also, to cure this infection also, ampicillin is useful. The pharmaceutical formulation of ampicillin is available in the capsule, tablet, oral suspension. It means that as far as the when we are adding in structural modification, when we are adding amino group on the alpha position, it results into its stable to the GI pH, as well as it's stable to the acidic pH and in alkaline pH, and hence it become orally effective. And that's why the formulation, oral formulations are available, such as capsule, tablet, and oral suspension like that. Okay, also available in the injectable form also, but the better advantage is that it is available in the tablet as well as the oral formulation also. Now the brands are Rosucillin, Ampicillin, and Ampipain. These are the popular brands for the given antibiotic ampicillin. Okay, Rosucillin, Ampipain, and Ampicillin. So that all about the ampicillin. Next is the carbancillin. Carbancillin, actually just the change or the difference between the ampicillin and the carbancillin is that instead of amino group on the alpha carbon, there is a say carboxylic acid group, COOH. If there is an amino group, the entire structure become ampicillin. If there is a presence of carboxylic group, that is COOH group, on the alpha carbon, it become carbancillin. So that's such a structural similarity as well as the difference we had seen between the carbancillin and ampicillin. Next, color, it has a white, odorless, bitter crystalline powder, hygroscopic in nature, and it is freely soluble in water. As far as the storage condition, it should be stored in tightly closed light resistance container, but the temperature not exceeding 5 degrees Celsius. It means it should be stored at cold temperature, not exceeding 8, not exceeding 5 degrees Celsius, means it's a cold temperature. Next, it is used prophylactically, parenterally also, in the treatment of respiratory tract infection, such as Pseudomonas, then Pseudomonas species, then urinary tract infection, UTI, and septicemia. These are the say common infection in which the given drug, that is the carbancillin, is useful. Next, formulation injectable. It's available in injectable form. Next, carbipain and carbaline. These are the actually the brands for the given drug carbancillin. Next, amongst the penicillin types of antibiotic, that is cloxacillin. So it has an isoxazole ring in the side chain, amino acyl side chain, that we had relatively seen in the structural say modification part of the antibiotics, and that the isoxazole ring it will be the cloxacillin. Structure is not that much of important, only the physical properties we will discuss, that it has a white odorless crystalline powder, intensely bitter taste, crystalline powder, hygroscopic and freely soluble in water. Next, stability storage condition as usual, as like that of the previous one, temperature not exceeding 25 degrees Celsius, on that we have to store. Next, if it is intended for parenteral administration, the container should bear the special instruction, that is the sterility criteria, that obviously we are following the sterility criteria when we are injecting the formulation or injectables. If we are preparing, it means what, it should be sterile and sealed, and it should be exclude the presence of microorganisms. It should be free from microorganism. If it is not intended for parenteral use, then there should be label that not to be injected. So it got clear, it should be clear on the label that whether it is for injectable or not injectable, not to be injected. It means that if it is injectable, for injectable, it means that it should be sterile. We'll follow the sterility criteria. If it is not, then no need to follow the sterility criteria, but should be mentioned that it not to be injected. Okay, because the hypotonicity and the problem associated problem may create when it is not sterile or it is not isotonic, then there may be a problem. So that's why, in order to avoid that one, the label should have clear instruction. Next, the uses of these antibiotic cloxacillin, that it is used in the respiratory tract infection, urinary tract infection, otitis media, septicemia, endocarditis, meningitis, and bone and joint infections. So in all these types of infection, these antibiotics is effective, and it is available in both tablet and injectable form, as well as suspension form, again available as the formulations are concerned. As well as the brands, the Cloxa A and Cloxins, these are the popular brands for the given drug cloxacillin. Now, hence, that was the last example cloxacillin we had seen amongst the penicillin types of antibiotic, but still it was the beta-lactam antibiotics, because we had categorized the second part in the beta-lactam antibiotics. These are the cephalosporins. There are two types of antibiotics exist in the beta-lactam category. That is, first one was penicillins, that has a penam as a heterocyclic ring, and second one beta-lactam antibiotics. These are cephalosporin, which again have a beta-lactam antibiotic. That is a common property or common characteristic between the cephalosporin and penicillins. But what will the difference? We'll see in the structure. So this we are talking about the cephalosporin types of antibiotics. So it is again a beta-lactam antibiotics, just we had seen, but it is a fusion of beta-lactam with the 6-membered 2,3-dihydro 6-H-thiazine ring. In case of penicillin types of antibiotics, the 4-membered beta-lactam ring fused with the 5-membered thiazolidine ring. Now in this case, it is fused with the 6-membered thiazine ring, because it's a 6-member ends with INE, and that was saturated in case of 5-membered, saturated in case of penicillin, that was thiazolidine. So that is a basic difference. And after the fusion, now nitrogen is common. Nitrogen is common in both the rings. Both are heterocyclic ring, 4-membered and the 6-membered ring. Now, as far as the numbering is concerned, but it show there is a special characteristic in the heterocyclic ring, presence of the double bond between the 3 and 4, and that is required for activity. So that is why now it becomes 3-cephim. In the heterocyclic ring, exactly when we had seen at that time, we had seen cepham, not seen cephim, but in this case it is cephim. Why we are calling cephim? Because there is a presence of double bond. So cepham become cephim due to presence of double bond, and the double bond lies between 3 and 4. That's why we are calling 3-cephim. So this is a complete entire heterocyclic ring we are calling 3-cephim, which will be commonly present in all cephalosporin types of antibiotics. Okay, so 3-cephim you got clear. Now numbering, as far as numbering is concerned, so we definitely will start with the sulfur, OSN, sulfur 1, 2, 3, 4, 5, 6, 7, 8. So one thing is that in penam types of antibiotics, so penam heterocycle, nitrogen getting 4 position. In this case, it getting 5 position. Whereas acyl side chain in penicillin types of antibiotics, it will be acyl side chain from 6th position, that is 6th amino penicillinic acid we already discussed. But in this case the side chain will be from 7th position, because additional one carbon is being increasing over here. Instead of a 5-membered ring, there is a presence of 6-membered ring. That's why additional one carbon is increasing, and the numbering to be skipped to the next one. Okay, instead of 6 there will be a 7, instead of 5, instead of 4, nitrogen getting 5 position. So that's why one number is being skipped to the next one, that is due to additional one carbon in the heterocyclic ring, that is in 3-Cephim. So 3-Cephim will be present in all types of cephalosporin types of antibiotics. So we'll see the one by one example. Just we had discussed this common property or common structure of cephalosporin types of antibiotics, the heterocyclic ring present in the all cephalosporin types of antibiotics. Now this is the general chemistry regarding the all cephalosporin types of antibiotics. So in this case, the presence of double bond between 3 and 4 maintains the strain of beta-lactam ring, and it increases the resistance toward the beta-lactamase enzymes. So due to presence of this double bond between 3 and 4, it making it as an enzyme resistance. So beta-lactam ring become more stronger, the strain become more strain, and maintain its strain, as well as it cannot be breakable by the this beta-lactam ring cannot be breakable by these enzymes beta-lactamase, and that is why it is more stable. Next, presence of acetoxic group at 3rd position, that is R1, indicate the presence of acetoxic group. Carboxylic acid group at 4th position. In case of penicillin it was 3, now it become 4 position. Carboxylic acid group in case of cephalosporin types of antibiotics, and the amino acyl side chain is at the 7th position. As far as the numbering is concerned, the amino acyl side chain will be at the 7th position. In case of penicillin it was at the 6th position, but in this cephalosporin it will be at the 7th position. So that is to say generalize the point regarding the chemistry of cephalosporin types of antibiotics. So first example we are going to see, that is cephalexin. So actually exactly the structure of these cephalosporin types of antibiotics are not important, just we had discussed the general structure of cephalosporin antibiotics. So now we are discussing the cephalexin antibiotic example of cephalosporin. Properties, physical properties, it is a cream color, characteristic odor, bitter taste, as well as crystalline powder and sparingly soluble in water. When it is mixed with the acid mixture, that is mixture of the concentrated sulfuric acid and nitric acid, this is called as acid mixture. So when the cephalexin is treated with this, it gives the yellow color. So that is a chemical property, as well as one of the identification criteria or identification tests. When it is react with the acid mixture, it will give the yellow color. Next, stability storage, it is absorbable, absorb moisture. It absorb the moisture means it is definitely hygroscopic in nature and affected by light also, hence it is to be stored in tightly closed light resistance container and temperature not exceeding 30 degrees Celsius. There is a normal conditions for storage of this antibiotic cephalexin. It is in the respiratory tract infection, skin infection, skin and soft tissue infection, otitis media, genitourinary tract infection, bone and joint infection, dental infections. All these types of infection in these antibiotics are effective, and it is available in the form of both capsule, tablet and mixture. Cefixime, Neosep and cephalexin, these are the popular brands for this given antibiotic cephalexin. And one thing I want to tell you all people, that nowadays only few of the penicillin types of antibiotics are common in practice, particularly these ampicillin will be there, or amoxicillin, the more modified form amoxicillin. These antibiotics are normally used nowadays, remaining not okay, but in case of the cephalosporin types of antibiotics, most of these are useful nowadays, even they are used. It means that they are now in a practice right now, they are not to be outdated. Okay, so these are again most, because they are newer antibiotics. Cephalosporins are newer antibiotics as compared to the penicillins. So these are the brands: cephalexin, cefixime, Neosep and cephalexins are the brands of the given antibiotics. Next, cephaloridine. Next example is cephaloridine among the cephalosporin types of antibiotics. It has a white odorless bitter crystalline powder freely soluble in water. When same chemical property it shows, but there is a forming a blue-green color. In case of cephalexin, it will give the yellow color, but in case of cephaloridine, When react with acid mixture, it will give the bluish green color. Stability condition is same as like that of the previous one. Uses urinary tract infection, respiratory tract infection, skin and soft tissue infection, and bone and joint infection. So all these infections, to treat all these infection, these antibiotics is used, that is cephalosporin, and it is available in the injectable form. Cephalosporin and cefadine, these are the brands for the given antibiotics. Cephalosporin, and this is the last antibiotics amongst the cephalosporin types, that is cephalothin, which is a white odorless bitter crystalline powder and freely soluble in water, and it is to be stored in tightly closed light resistance container. There is a common instruction not exceeding 25 degrees Celsius, and again the labeling instruction is there. We already discussed that if it is intended for parental use, the sterility criteria to be followed as well as mentioned on the label, and if it is not for the parental use, then again it should be mentioned that it is not for injectable, not to be injected. It should not be injected, because if it is mentioned that it should not be injected, it means that there is no sterility parameter it has been followed, and that's why it is a riskier one to injected. That's why it got clear from the labeling instruction that whether it is to be injected or not injected. And next, uses similar as like that of the cephalosporin, that is using UTI and RTI, that is respiratory and urinary tract infection, infection of soft tissues and the skin, bone and joint infection. Cephalothin injection, again Keflin and Cephalin, these are the two brands. So in this way we had finished all cephalosporin types of antibiotics. The next category is actually the aminoglycoside, as it will come in the non-beta-lactam antibiotics. So this was the last example that we had seen that comes under the beta-lactam. So overall we had seen under the beta-lactam two types of antibiotics, penicillins and cephalosporin. I want to summarize the example of the penicillins. These are, say, benzyl penicillin, phenoxymethyl penicillin, ampicillin, carbamazepine, cloxacillin. All these are the examples including or comes under the penicillin types of antibiotics. Whereas cephalosporin types of antibiotics, in that, say, cephalaxine, cephaloridine, cephalothin, all these are the antibiotics which are cephalosporin, and both cephalosporin and penicillins both are beta-lactam antibiotics. So first major class we had finished, that is the beta-lactam types of antibiotics. Next we have to move towards the non-beta-lactam antibiotics, in which there are again subclasses. So that we'll see in the next part, that is non-beta-lactam antibiotics. Thank you so much. Thanks for patient listening, and thanks for watching the video. Thank you so much.